A warm welcome to all our viewers to our series Natural Medicine. I'd like to dedicate the topic of today's episode to our blood. The blood that we have must have a certain purity. And I keep hearing that there are certain heavy metal loads nowadays that burden us and are also detectable in the blood. And that you can even wash the blood. I actually only know that from dialysis. But that's not what we want to talk about today. It's really, how do you get the dirt out of your body? And I'd like to address this today, on the one hand, with Dr. Friederike Wickel from the Swiss Mountain Clinic. Welcome.
Thank you, Alexander.
And of course, the great master, I always say the greatest doctor I've ever known. Although I've known him for at least 20 years, he's been practicing for 48 years. It's Dr. Dietrich Klinghardt. Dear Dietrich, a very warm welcome once again. Thank you, Alex. Thank you, Friederike.
You're welcome, Dietrich. We've had the Inus Ferris with us for half a year now. The Inus Ferris is said to be the fastest way to detox. And I remember you always said this is one of the best ways to detoxify the brain above all. Can you tell the audience a little more about that?
Yeah, that's true what Alex said. The origin was dialysis. Dialysis, where basically it's a first attempt to wash out the pollutants in the blood that accumulate there. And our blood is strange. On the one hand, it provides us with nutrients and oxygen. On the other hand, our blood is also the sewer into which everything is first shoveled back, the toxins and metabolic waste that accumulate. It first goes back into the blood and then has to be detoxified, either by the liver or the kidneys. And it was my great teacher, and perhaps the greatest toxicologist of our time, Dr. Richard Straub, who picked up this method from Japan, apheresis. I'll describe the apheresis very briefly. The blood is basically drawn from one arm, then passes through a filter system, is washed, and then fed back to the other arm. And the special thing is this filter system. This is from Japan. This is from the sea. It's a sea sponge, which has this fine tube system of thousands of kilometres of fine tubes, and there the blood is pumped through. And this sponge has the ability to basically remove all pollutants from the blood that are not associated with life. That said, it's really something special. And Straub further developed this system and then patented it himself under the name Inus Ferris. And now it basically looks like this. We only have about 5 litres of blood in total, and I weigh 75 kilograms. And these 5 litres of blood are now being washed. They're being swept completely clean in this system. That takes about 2 hours, 2.5 hours, that you're connected with the device. And there's also a collection bag, which is also quite scary. What you see in there, what's filtered out there, and what can then be examined afterwards. And this investigation afterwards shows that we are full of petrochemicals, stuff from farming. Everything that's sprayed there, and of course heavy metals, but also inflammatory factors, cytokines that shouldn't be there, and ultimately viruses and bacteria, which are filtered out. And now, if you clean up those 5 litres of blood, then there are still the other 72.5 kilograms. And then the other part is still there and still toxic. But then the following happens there is the so-called osmotic gradient, that the toxins that are now in the connective tissue or in the brain, when the blood that is nearby is completely poison-free, and the only thing, and the cells next to it, and the connective tissue next to it is full of poisons, then these poisons run into the blood now. And so after every Inus Ferris, the brain and the connective tissue in the body clean themselves, and the cells in the body then give off a certain part of their toxins. And to this day I find that interesting. There is still no remedy that successfully removes heavy metals from the brain. We know DMPS, DMSA, EDTA. None of these agents cross the blood-brain barrier. But with the apheresis, or with the ionospheresis, we can get there really well. So we create this osmotic gradient, and then the toxins simply tumble out of their brain cells into the connective tissue, and from there into the blood. May I briefly bridge a gap for our viewers, so that they can also see to what extent the topic affects them too? Well, you once explained to me that the causality between Alzheimer's, forgetfulness, or even dementia is related to aluminium and heavy metal pollution in general. So all these viewers who think they tend to forget or they would never like to experience dementia would actually have great chances with the reduction of their heavy metal exposure to not get into this direction. Is that correct? Yeah, absolutely. Therefore, until recently, there was only ever the possibility to go to Lower Bavaria to have this procedure there with long waiting times. And now that it's available in the Swiss Mountain Clinic, it is, of course, great for all of us that there are more possibilities now where people can detox. And I believe that we know where everything is going right now. We know that electric smog will keep increasing until the extent of the catastrophe we're heading into is really recognised. But the same goes for all the environmental toxins. At the moment, there's really no serious attempt to reduce it. But it is becoming more and more, and so it becomes more and more important that the anticipatory measures that we have, then they're more and more necessary. This is no longer the luxury of a few people who have their brains detoxified, but actually each of us should understand that it is now part of the compulsory practice. I'm 70 years old now, and I don't feel like dying any time in the next few years. But I want to keep my brain as young as possible. And of course, it's very clear to me to go for apheresis and ionospheresis once a year. And then, ideally, this is always done once on Monday and then again on Wednesday. Remember, during these 2 days during the break, all the toxins run out of the brain cells from the connected tissue into the blood. And the second apheresis is even more important than the first. So it should always be 2, in my opinion. But I'd like to hear from Frederick how you're doing it. But I think you do it in the same way. That is, it's ideal not to do just one session, but ideally 2 sessions or even more.
Definitely. I also wanted to add that, as a comment, that it makes sense precisely because of the effect that you just described with the mobilisation, that you do the second apheresis after 24 to 48 hours. And we've seen that before, and especially patients with real neurological illnesses or tiredness, attention problems, difficulty concentrating, suddenly become clear in their head. They can suddenly think. We also had a dementia patient. She just sat sleepily on the chair. After 2 apheresis, this woman was able to speak clear sentences, so it's really moving what the patients can achieve without changing their lives insanely. I always find that very interesting, especially for men that are so confident with what they're doing, like these managers, who don't really want to change anything, but they can achieve such a lot with apheresis.
You said your age earlier. I'm 52. I've now also done 2 ionosphereses, simply as health prevention, as you have recommended it to me. And what was in that bag was really unbelievable. The whole corner was full of heavy metals. It's unbelievable. You could probably have sold this eluate, this bag. You think? I believe that each of us should find a routine with certain things we do every day. For me, it's taking chlorella and other remedies that detoxify my body, including organic food and including healthy sleep, including protecting myself from electric smog, especially at night. But even these larger measures are simply part of the process if we want to survive this time with a healthy brain. And the inospheresis has a very, very high priority for us.
That pulls out the glyphosate and all this too, doesn't it?
Yeah, of course. The glyphosate, we hadn't really looked at it because Dr. Strauber hadn't included the glyphosate in the arsenal of substances that he tests until recently. And now it's there and is, of course, high for each of us. Glyphosate, definitely. And then the appropriate things from Syngenta that are structurally very, very similar. From Switzerland, or you all have your own stuff in Switzerland, which then have a different name, but which are just as bad as glyphosate. And of course, there are certain toxins in us, especially in the nervous system, which we can only access via the inospheresis, where at the moment there is no substance, no means that we can ingest or inject that gets these things out. But really the inospheresis has a special function here. Originally, maybe I'd like to say that apheresis was developed for people who have major problems with their lipid metabolism, who have this lipoprotein 2A, and who have high triglycerides, and where the LDL cholesterol, the oxidized cholesterol, is very high. For these people, the insurance in the USA even pays the apheresis, but then has to be done once a week, and then that's in a different place that way. And then I actually think this part can be solved even better with diet changes and exercise and certain herbal products that we give. So they're exactly where academic medicine gives its approval for apheresis. I say there are other ways we can go, but when it comes to detoxifying, apheresis is fantastic.
So the apheresis, the audience must also know this. It is a very expensive matter. This is not a cheap therapy. If mobilisation is good again after 24 hours, but the patient can't afford a second apheresis at all, because this has to be discussed, the health insurance doesn't pay for it, then what would you recommend? Because the toxins are mobilised.
So, if patients really understand how much they are getting for the price that they pay, then for most people it's worth it to have the second apheresis. Now, of course, I know from my own experience that often one apheresis is great, but two is great to the power of two. That's not great plus great, but great to the power of two. The profit then goes up exponentially. And most of the time, when people know what future they'll get from it in the end, that is, so to speak, the price we pay for a better future. If people really get it, then apheresis is actually not expensive.
And would you plead for 2 aphereses every time the patient comes? Or do you then say the follow-up aphereses only once?
I can't answer that like that. Definitely when the patient is symptomatic, so someone has memory loss, chronic fatigue or amyotrophia, or has a diagnosed chronic illness, then definitely twice. But if a patient feels super good and is all balanced, then once. Once really as prophylactic, but when it's needed to make therapeutic progress, then definitely twice. Now, I have to ask again as a layman, so doing a preventive inospheresis once a year, so washing the blood, doesn't make sense? Or make sense of what? It definitely makes sense. So you can intensify the effect of inospheresis, even with the one-time treatment, by exercising massively right before it. So what we do is that we put people on such a bicycle ergometer where the patient has to work up a sweat where a lot of these pollutants are mobilised, which can then be picked up via the blood. So there are tricks how you can optimise that when you do a one-off apheresis. We can also use ultrasound, because I published a work on that. We can use the ultrasound on the critical areas where the patient is sick, liver, kidney, heart, even during the inospheresis, to drive out the toxins from the organs into the blood. And that's something where I'd also like to work with you someday, with Dr. Vikal, to develop these parts, because that's where we really have a lot of experience, which I also published in a good magazine, the American Journal of Immunology, that the ultrasound in this context can be incredibly valuable. That patients can have exactly the same inospheresis, but we use basically windows in the head where you can use ultrasound on the whole brain. And of course, there are ways in which we can use the ultrasound on the heart and the lungs and the kidneys or other areas. If the patient has prostate problems, we do it on the prostate. And then set the toxins in motion that come out more during this apheresis, even if it's only done once. An ultrasound doesn't hurt, doesn't cost anything extra, and there's a fantastic way. So there are many options. Apheresis is still young. It's a fantastic technique, what the technique itself already does. And now additionally to build or install things around it that reinforce the whole thing. So we use this vibration plate in the past for apheresis, that people will sit on such a vibrating plate while they're receiving this infusion. There are still many ways to optimise it, but at the moment it's already fantastic as a method, and as a single method with certainty, one of the most effective and powerful medical healing methods. I once had a doctor here who told me something. I'd like you to verify it right away. He once told me that we could compensate for the daily toxins we get with a certain intake of microalgae. Well, I'm actually the pioneer when it comes to that. We mainly use the algae chlorella. This is a freshwater alga, but we also use brown algae from the sea. Algae have two parts. Algae have membranes that can bind large amounts of toxins. So when they go through the intestines, they extract from our intestinal bacteria and from the intestinal wall, and also from the blood, these poison parts out through the intestinal wall, which are then removed along the way. And then another part of the algae is the parts that get absorbed. There's alpha lipoic acid, there's glutathione in it, there's methyl vitamin B12 in it, and substances that we need to stimulate the detoxification enzymes that we have in the cells intracellularly. That said, algae are great, but algae can't do everything, and every alga is a bit different in what it binds and what it does not bind. And ultimately, today, for every 10 poisons or poison parts that we ingest, it's about how do we get to detoxify one. As soon as we get this ratio right, we get a little bit healthier every day. But if we detoxify only 9 for every 10 poison parts we ingest, we get sicker every day. And maintaining this ratio is becoming more and more difficult. And that's why systems such as apheresis, inospheresis, are fantastic for simply discharging a huge part to get the ratio right again. I'm impressed. Do you have another question?
No. For me, it really is one of the strongest detox procedures we have. And you say you do it once a year, but you are not sitting at the source. I do it 3 times a year and I'm 35, so it's important to me to practice prevention today. Even if I have a healthy lifestyle, that's what I wanted to add.
Yeah, then do you have another wish, dear Dietrich? No, I just want to say that I've known apheresis for almost 10 years and send my people there regularly. And it's fantastic as an add-on method. The method can also be used for very, very serious diseases, but then it has to be done more often, even up to once a week, twice a week. In Parkinson's disease, we have had cases where the patient then moved nearby to Lower Bavaria, in that case, and then had the apheresis once a week or even twice a week for 3-4 months, and then the big breakthrough came when the disease suddenly disappeared. Similar to the ALS disease, where today almost every patient dies from it. We've seen the first great successes when that's done intensively. Then there are restrictions. The patient needs relatively good veins for it, or there'll be difficulties for the nurse, or for the people who do the apheresis. There are practical limitations as to where it's possible and when it's not possible. But I think the possibilities have not yet been recognised and used. What you can do with this great method. And, of course, I trust that Petra, as a co-pioneer of the method, that you will surely discover a lot that is not yet known.
Totally. And also, just to say, also people without good veins. We can put an inguinal catheter, so they already have the opportunity to receive an apheresis.
Perfect. Oh, you did that to my wife. Exactly. You did it. That's great that you can do it. I know people in the US who do apheresis where no one is able to put an inguinal catheter. And of course, that's fantastic. If you have that. This is, of course, completely different field again, because most chronically ill people don't have good veins.
Sure. And of course, when you say vibration plate, with the inguinal catheter, all of this is much more possible to get the patient moving too, than with these two steel needles.
Yeah, fantastic. This is all good. It's definitely about time that I come to Lake Majora or the southern edge of the Alps. It is. I've wanted to visit Petra for a long time, or now both of you. I'm looking forward to it, as soon as travel picks up a bit. That has been bad for the past year and a half. Every time I come back to England, where my children grow up and where my partner Daniela is, it's always 2 weeks of quarantine, 2 weeks of house arrest, with daily visits from the police to see if I'm really here. So travelling just got a lot harder. Because of these restrictions, but hopefully, let's hope that now a little of this madness becomes a little more sensible. I'd like to go into the closing quote. You said in one sentence that it remains to be seen what the inispheresis will be good for. If I look at it the other way around, then it's almost sad to see that actually harmful substances pollute the environment and us all so much that we actually have to look for a solution in the inispheris, and that we actually all have no focus on these centres of pollution, which come from commercial things or God knows what all. We're simply exposed to them as humans, exposed to life, just so that some people can make a profit, no matter whether that's true or not, or out of negligence or out of ignorance. I really don't know. But it is sad that science, like the two of you, has to tread such paths in order to simply still help people. I'm really sorry for that. But anyway, you, dear Friedrich, thank you very much, and especially you, dear Dietrich, you as a scientist, that you train countless of therapists and doctors again and again. Keep researching, don't give up, continue tirelessly, even if you are shot at from all sides. Great respect, I think, from all of our viewers. I'm very sure you enjoy and you deserve to be a great doctor and to receive the highest respect from us. Dear Dietrich, I wish you all the best for the future, with all my heart. And I hope you can enjoy these inisphereses in Switzerland. You were invited by the Swiss Mountain Clinic, and then I hope that we will finally see each other in person, not just via Zoom. Thank you. You're welcome. And Frederica, say hi to Petra.
I'll do that. Bye.
Thank you. Bye. See you next time. Dear viewers, that's it for today. Thank you very much for watching. And I wish you all the best and see you next time.